I'm here today with Dr. Christopher Rapuano, President of the AAO and Chief of the Wills Eye Cornea Service, for our first ever game of Academy Fact or Fiction Advocacy Edition. So the game is simple. I'll ask you an advocacy related question and you'll tell me if it's fact or fiction. And if you win, you get a whole bag of chocolate chip cookies. How does that sound?
Great.
Okay, fact or fiction. Physicians are the only Medicare providers who do not receive an annual update tied to inflation when policymakers set reimbursement rates.
Unfortunately, that's correct. It's a tragedy because how can you have a practice that doesn't get increases for inflation when hospital line looks like this over the past 10, 20 years and the doctor's line is completely flat, which is why we need to go to Washington to advocate for this with our legislators.
That's right. The Academy's Mid-Year Forum in Washington, D.C. from April 15th to 18th is where we can come together and stand up for our patients and profession at Congressional Advocacy Day. Are you ready for another one?
Yes.
All right. Fact or fiction? Ophthalmology fails more often than it succeeds, protecting its surgical scope of practice.
Incorrect. So ophthalmology is, I don't know the exact numbers, but something like 90% successful, if not higher, in defending scope battles around the country historically. We also need to remember that we need to protect eye care in the VA system for our veterans, and that's at a national level, which is where Mid-Year Forum comes in, where we meet our national legislators.
Fact or fiction? Ophthalmology has the first FDA-approved autonomous AI tool in the field of medicine.
That's correct. The AI system is used to diagnose diabetic retinopathy based on fundus photos, and that's the first one in all of medicine, not just ophthalmology, for retina. And it's been used actually to identify this diabetic retinopathy in an FQHC pilot project in the state of Delaware. And that is extremely helpful to get patients into care.
Fact or fiction? Individual ophthalmologists meeting with their representatives don't really move the needle on policy.
Incorrect. No, in fact, individual ophthalmologists who meet with their legislators is the best way to tell the stories of what's going on in our offices, taking care of their patients, especially stories from young ophthalmologists and how this affects them and their future and their care of their patients really makes a big difference to these legislators. And I think people are getting the message because the attendance at Mid-Year Forum has gone up year after year, and in fact has been record-breaking the past 2 years.
Yep. Okay, last question for the whole bag of cookies. Fact or fiction? The best advocates are policy experts with extensive government connections.
No, that's not true. Best advocates are those who can relate their lives and their care of patients with legislators. You don't need to know all the details about exactly what percent of Medicare is going up or down or things like that. Legislators really want to hear stories about how this affects the ophthalmologists' lives, but especially how it affects their patients' lives.
You're right. No experience or expertise is required because the Academy makes it easy and rewarding to participate. So if you're ready to get involved, we hope you come to Mid-Year Forum, April 15th through the 18th, 2026 in Washington, D.C. to join us in advocating for our patients and our professions. We hope to see you there.
I've been there numerous times, and it's always a really fun event. Everyone who comes really, really enjoys it and gets a lot out of it.
Awesome. As promised.
My cookie.
Your cookie.
Thank you very much.
You're welcome.